We are back with Dr. Cynthia Snider, Cone Health Infection Prevention Medical Director. We're talking about flu season. So we're talking about who should get the flu vaccine, and that's almost everyone. One of the things you said was you touched on the high dose flu vaccine. Let's talk again about who that's recommended for and if the side effects are the same.
So, the high-dose vaccine is really tailored for folks who are 65 years old and older. And the reason being is as we get older, our immune system tends to not be as kind of wanes down a little bit, more so than when you were younger. And so those components or the adjuvant can create a little bit more side effects, but it's not thought to be significant.
Okay.
And again, it's more the kind of the aches and maybe a low-grade fever after you get that vaccine.
So, I mean, I think that's kind of like the plan is if you can take it easy the next day or so after the flu vaccine.
That's correct. And then usually we try to give it in the arm that you're dominant in, so you're working your muscle out, and so it's less soreness in your arm.
Because that actually helps when you are moving it to lessen that feeling. Okay. So a lot of people just do not like a needle, and they're like, I don't want to get that. They want the nasal spray flu vaccine. Is it an effective option like the shot? And who might that be more geared to?
Correct. So there is a needleless vaccine. So it's called Flumis. It's an intranasal vaccine, and that is actually a live attenuated vaccine. So just a little bit of live virus, I would say, of how to describe it. And it's really for folks who are between the ages of 2 and 49 years old. It's not for kids who are under 2 years old. There's also some limitations, like we would not want somebody who's pregnant to receive it, somebody who's immunocompromised, or if you're living with somebody who's immunocompromised, because there's a chance you can also infect them. So the only thing, though, is that you likely have to check with your pediatrician's office or the pharmacy to see if they're carrying it, because it's probably not as prevalent as the shot.
To make sure that it's there. Don't be walking in just thinking everybody's got it fully stocked. Got it. Okay.
Correct.
So let's talk about if you're not up to date on your COVID vaccine or you're in need of getting the RSV vaccine. Is it okay to get all three of them together? Do we need to space them out?
It is perfectly safe to get those vaccines together. We sometimes really advocate for that because it's like one-stop shopping. You're getting all your vaccines. Granted, you'll probably still feel like achy that night. But if some of my patients, they prefer to stagger them, that is also fine, where they would wait a week before they get their next one.
Okay, so no danger in putting them together, no danger in staggering them, either way.
Correct.
Okay. All right. So in addition to getting a flu shot, let's talk about some other just regular everyday things that we can do to keep us away from the flu, keep our family and friends away from the flu too.
Yeah. So it's kind of this, just the basics of hand hygiene, especially our coughing etiquette, not to cough in your hands and then shake someone else's hands or touch things, and also masking, so if someone is starting to notice that they're feeling ill, the best thing is try not to attend a busy meeting or a gathering, and also you could wear a mask so it protects from shedding virus to others. And I think the other thing that's also good is that now we're starting to see in the grocery stores, you'll see both the COVID and flu test, diagnostic tests together. So I believe they're anywhere from $10 to $20, and that's useful if you're having symptoms and you're worried, which could it be, and so you can get tested that way.
Because they're kind of similar, and some of the symptoms are kind of similar.
Exactly.
And is the only way really to know is to take the test?
That's correct.
Okay, and we're wrapping things up, but any final thoughts on flu shots, how to stay healthy during this fall respiratory season?
Yeah, I think the best advice I have is, get out there, get your shot, and then have a really healthy like upcoming winter.
That's right. We want to be healthy from October all the way through March and just skip flu season altogether. We appreciate your time and expertise. Hey, if you missed any of this, maybe you need to send it to someone. They were just maybe asking stuff about the flu shot. It's going to be in the 2-year well-being section of our website.